So the most widely used illicit drugs are marijuana, cocaine, methamphetamine, and psychedelics. This does not include abuse of prescribed drugs, which is very, very common. So we're going to talk about these illicit drugs in a little bit more detail. Marijuana, going over the basics of absorption and distribution. It is most often smoked and taken orally. The metabolism of marijuana is quite long, so the half-life is actually 24 hours. So this means that after you smoke, then the metabolite or residual toxicity is actually detectable for up to 60 days. So this has major implications for drug tests. And of course, 24-hour half-life is a very, very long time. So if you were to smoke at night and have the capacity for it to affect you in the morning, this would be something that would need to be considered. The addiction potential of marijuana is quite low compared to other abused drugs. And part of this has to do with the very long half-life, and that you wouldn't necessarily need to engage in repeated administrations as you would for other illicit drugs. The excretion rate is also quite low. It's below 1%. The primary ingredient is THC. This is the psychoactive constituent. Although over 80 others are present, marijuana actually used to be legal and it was made illegal. And one of the theories behind the illegalization of marijuana was that the beneficial health properties were known, and so because marijuana at that time was free, it means that drug companies could not benefit from using it as a drug. So they participated in the illegalization process of marijuana and tried to replicate some of the properties of marijuana by developing a drug. I don't remember the name of that drug, and what they found was that it was not actually able to be reproduced effectively for the primary reason that in addition to some of the main ingredients, you have all these other ingredients, over 80 other ingredients that really interact to affect its function and effectiveness. And so artificial forms of marijuana or cannabis that try to replicate some of the adaptive properties have not been able to be reproduced. Marijuana binds to the cannabinoid receptor, and in this way it mimics anandamide, which floods the synapse with dopamine. If cannabis mimics anandamide, which floods the synapse with dopamine, would marijuana be considered an agonist or an antagonist? Think for a second, which mimics or enhances, an agonist or antagonist? Marijuana would actually be an agonist in which it increases and enhances anandamide, which leads to greater dopamine. There are a number of adverse effects of heavy marijuana use. First off, I'll state that research suggests that the negative effects of long-term use are far less than those associated with alcohol and tobacco. However, it's been quite difficult to conduct controlled clinical trials that examine the long-term effects of marijuana use because it is an illicit drug. So it may be that there are some negative side effects that have not yet been identified. There are respiratory problems. People can experience cough and bronchitis and asthma. And a single large dose can trigger heart attacks in susceptible individuals. There are quite a few medicinal uses of marijuana. It treats nausea and blocks seizures. It dilates the bronchioles of asthmatics. And so, of course, you have this situation where a negative side effect can be some problems with asthma, but marijuana is also used to treat asthma. You can have decreased severity of glaucoma, and you can also reduce some forms of pain. One of the very interesting things about marijuana that most people don't realize in this whole medicinal legalization of marijuana battle is that the vast majority of doctors agree that marijuana has medicinal attributes, and that there are strengths and benefits to using marijuana as a medicinal drug. There was a very, very interesting interview on NPR in which proponents and opponents of legalizing marijuana were participating in a panel, and all of them were doctors. And when the moderator asked the opponents to legalizing marijuana why they did not support the legalization, one of the questions they asked in particular was, do you believe that marijuana has these positive benefits? And the doctors on the panel said yes. Research is relatively indisputable that marijuana has some of these positive benefits. However, one of the largest problems with legalizing marijuana for medicinal purposes is that of dosing. When you take a drug, you have a very specific dosage that would be beneficial. Many, many drugs, if a certain dosage is beneficial, but if you take too much, then it is a problem, and if you take too little, then it doesn't help. So at present, it is very, very difficult to figure out the best way to dose marijuana. You can't do anything like, well, go home and take 1 puff or take 2 puffs. Everybody's different. How big of a puff? How small of a puff? And of course, I'm delving here into some topics that have political connotations, but I want you guys to understand the reality of the situation. I'm not making any stance with regards to being a proponent or an opponent of marijuana. That is not my job. But I want you guys to be aware of both sides of the argument, that while there are these positive effects that have been identified, there are negative effects, and that when an individual is high, they are not able to make as balanced and informed decisions. When you're high, then it of course can at times negatively affect your decision making. You should not drive, you should not operate heavy machinery, you should not do any of those things. And so you want to be very, very aware of how it can affect you. And if marijuana has such a long half-life of 24 hours, then you would need to be really, really careful about the dosage that you would take to treat a particular disorder. There are, of course, some elements of cannabis where the dosing structure has been worked out. That's primarily oils. You can have an oil that is used most frequently to treat epilepsy, and because the dosing structure of the oil has actually been worked out, there are a number of states that have approved the legalization of the use of this cannabis oil, but only that oil. And the broader element of smoking or inhaling marijuana, that is a lot more problematic. And of course, you can actually breed the plants to increase some properties and decrease others. So while marijuana can treat all of these things, that they're not exactly the same strains of the plant. So you can actually vary some of the content of the THC. So you can actually have lower content of THC so that you have lower properties associated with getting high that will still have some of the beneficial effects. And so it's really clear that more work needs to be done on how marijuana should best be used medicinally to provide the benefits that it can and to minimize the negative consequences. We also have cocaine, and the basics in terms of absorption and distribution is it is injected, it is snorted, and it is smoked. And it can also be taken orally. So here we have 4 routes towards absorption and distribution of cocaine. The half-life is 30 to 90 minutes, which underscores how addictive it is, because you would have to take multiple dosages, and every time you would take a dose, you would reinforce this addictive structure. Cocaine is highly addictive, however, the withdrawal is relatively mild. Excretion is also low. In looking at the various properties, cocaine inhibits dopamine reuptake. So, if cocaine were to inhibit dopamine reuptake, would it be an agonist or an antagonist? If it inhibits reuptake, then that means that it stops the reuptake of dopamine into the presynaptic neuron. And if it stops reuptake, that means that dopamine stays in the synapse for a longer period of time. And if dopamine stays in the synapse for a longer period of time, then it has an enhancing effect, which would mean that cocaine is an agonist. It also can act as a local anesthetic, and this is one of the first ways that it was introduced to the medical system. It can also function as a vasoconstrictor and a psychostimulant. It has highly toxic effects, and it can result in acute paranoid psychosis, severe anxiety, hypertension, tachycardia, which would be irregular heart rhythms, and single dosages can result in heart failure, stroke, and death. So cocaine, the positive effects are very specific and limited in comparison to the highly toxic negative side effects, and it is also highly addictive.